The dog came in on a Tuesday, bleeding through a tactical vest that still smelled like smoke. Corporal Reyes was holding him, both hands pressing a field dressing against the animal's left flank, jaw tight, eyes the color of someone who hadn't slept in 4 days. The canine's name was Bravo, a Belgian Malinois, 4 years old, handler and dog deployed together out of CFB Petawawa, back on Canadian soil less than 18 hours when a training accident changed everything. They hadn't come to Hawthorn General on purpose. The base clinic was 40 minutes north, and Bravo was losing blood faster than time allowed. Reyes had driven straight to the nearest emergency entrance and carried the dog in himself, which is how a 90-pound military working dog ended up on the floor of the Hawthorn General Emergency Department at 7:14 on a cold February morning. That was how Maya Callahan found him. She was 31 years old, a registered nurse with 6 years in emergency, and she was the first staff member to come around the corner when the automatic doors slid open and Reyes walked through them. She took in the scene in pieces: the uniform, the tactical gear, the dog, the blood, and her training didn't hesitate even when her brain was still catching up. She was already pulling on gloves before she reached them. "What happened?" she asked, dropping to one knee. "Shrapnel fragment. Training exercise. Something went wrong." Reyes's voice was controlled in the way that military people learn to be controlled when the thing they love most is dying in their arms. "He needs a vet, I know, but the nearest emergency animal hospital is." "I know," Maya said. She wasn't looking at Reyes anymore. She was looking at Bravo. The dog was breathing. Short, shallow, eyes half open, not panicking. That was the thing about military working dogs that most people didn't understand. They were trained past the instinct to bite when they were in pain. Bravo lay still under her hands, watching her with the particular quality of animal attention that said, very clearly, "I trust you to do something about this." Maya Callahan was not a veterinarian. She was also not the kind of person who stood there doing nothing while a living creature bled on her floor. She called for a trauma bay. She assessed the wound. The field dressing had slowed the bleeding, but the fragment was still in there and Bravo's gums were pale, which meant he'd lost more blood than was visible. She knew enough. 6 years in emergency gave you a working knowledge of trauma that crossed species lines more than most people realized. The anatomy was different in the details, and not so different in the fundamentals. She kept her voice steady. She told Reyes to stay close and keep talking to Bravo, because the dog's cortisol would drop if he could hear his handler's voice, and lower cortisol meant slower bleeding, and slower bleeding meant time. Reyes looked at her like she had just handed him a rope. He started talking. Low, even, French and English mixed together the way people talk when they're trying to reach something deeper than language. Maya stabilized the wound. She got fluids running. She called the emergency animal hospital in Ashbury and had a senior veterinarian on the phone within 4 minutes, walking her through the rest of it in real time. Bravo was stable by 7:52 in the morning. The veterinary transport arrived at 8:15. By 8:20, when Corporal Reyes walked back through the department to find Maya and thank her, she was already at another bay with another patient. He left his card at the nursing station with a note written on the back in handwriting that was precise, the way only people who fill out military forms learn to be precise. She saved his life. Please tell her that. Maya didn't see the note until her break at 11. She smiled at it the way you smile at things that cost you nothing to do but meant everything to someone else. She folded it and put it in her pocket. She went back to work. Diane Pruitt found out at 8:45. She was the head of nursing administration at Hawthorn General, and she had been in that position for 11 years, which was long enough to develop opinions about the way things were done and the particular conviction that her opinions were the same as policy. She was 54, had the posture of someone who had never once relaxed in a meeting, and she ran her department with the kind of efficiency that looked impressive in annual reviews and felt, to the people working under her, like being managed by a very organized frost. She did not like exceptions. She did not like improvisation. And she absolutely did not like what she read in the incident report that landed on her desk at 8:45 on a Tuesday morning. A registered nurse had used hospital resources, a trauma bay, IV fluids, staff time, medical equipment to treat a non-human patient without authorization, without a veterinary license, and without Pruitt's approval. She had done it in full view of the emergency department. She had called an outside provider and established a phone consult that technically created a liability trail. Pruitt read the report twice. Then she picked up the phone. Maya was pulled off the floor at 10:30 and asked to come to administration. She went without protest. She had done nothing wrong, and she knew it with the calm clarity of someone who had made a decision in the moment and would make it again. She walked down the corridor with her badge still clipped to her scrubs and her hands relaxed at her sides, and she sat down across from Diane Pruitt in an office that smelled like recycled air and institutional carpet. Pruitt had the incident report in front of her like a verdict that had already been rendered. "You understand," Pruitt said, "that you are not licensed to treat animals." "I understand that," Maya said. "You used hospital resources without authorization. I used what was available to stabilize a critical patient while getting a licensed veterinarian on the phone. The dog would have died before transport otherwise. He is not a patient." Pruitt's voice did not change. It was the voice of someone who had made a decision before this conversation started. He is a dog. This is a human hospital. You do not get to decide on a Tuesday morning that those definitions no longer apply. Maya looked at her for a moment. He's a military working dog. He was in service of this country. His handler had no other option. I'm not debating the circumstances with you. Pruitt set the report down. You violated protocol. You created a liability. You made a decision that was not yours to make. There was a pause. "I'm suspending you pending review," Pruitt said, "and I am recommending termination." Maya sat very still. She had expected a reprimand. She had expected paperwork and possibly a formal warning and the specific kind of institutional discomfort that comes with having done something right in a way that made the administration nervous. She had not expected this. "You're firing me," she said. It wasn't a question. She just needed to hear it out loud to understand that it was real. "I'm recommending termination. Yes, for stabilizing a dying dog, for violating hospital policy, and exceeding your scope of practice." Maya stood up. She did it slowly, the way you move when you are concentrating very hard on not letting anyone see what's happening inside you. She unclipped her badge. She set it on the desk between them with a sound that was quieter than it should have been for how final it felt. "You should be ashamed of yourself," she said. Pruitt did not flinch. "Please collect your personal belongings from your locker. Security will escort you out." Maya walked out of the office. She did not cry. Not there, not in the corridor, not in the elevator, down to the locker room where she collected her winter coat and her street shoes and her phone charger and the photograph she kept on the door. Her and her sister at Lake Louise, summer before last, the mountains behind them impossibly blue. She pressed the back of the photo against her chest for a moment before she put it in her bag. A security guard named Dennis, who had known Maya for 3 years and couldn't look her in the eye, walked her to the exit. She pushed through the doors into the cold. February in Ontario does not soften itself for you. The air was sharp and exact, and the parking lot was half slush, half ice, and Maya Callahan stood outside the hospital she had worked in for 6 years and breathed until the tightness in her chest was just cold air and not grief. She had her car keys, she had her coat, she had her wallet in her bag and her phone in her pocket. These small certainties felt important. She drove home. She called her sister first. Nadia was a teacher in Kingston, and she had a gift for listening without trying to fix things, which was exactly what Maya needed. She sat at her kitchen table with her coat still on and told Nadia what had happened, and Nadia said, "I know," in the tone of voice that meant this is exactly the kind of thing that would happen to you specifically, because you are exactly the kind of person who would do the thing that gets you fired. "You don't regret it," Nadia said. It also wasn't a question. "Not for a second. Then we deal with it." They talked for an hour. Maya made coffee. By the time she hung up, the shock had settled into something more manageable, the way adrenaline always did, leaving behind just the tiredness and the outline of a situation that was going to require action. She called the Ontario Nurses Association that afternoon. She spoke to a union rep named Carla, who listened to the full account with a professional focus that made Maya feel, for the first time since the morning, like she was talking to someone who understood the terrain. "They suspended you pending review?" Carla asked, and recommended termination. A pause. "Did they give you the formal written notice?" "It should be in my email. Check it and forward it to me. Don't respond to it. Don't contact the hospital directly. Let me make some calls. Maya sat with that for a moment. What do you think? Honestly, I think Pruitt made a very fast decision without consulting legal. That's her problem now. Maya forwarded the email. She made more coffee. She didn't sleep well that night. What she didn't know, what she had no way of knowing, was that Corporal Reyes had already been making calls of his own. He had returned to base the previous afternoon with Bravo's stable at the Ashbury Emergency Animal Hospital, two vets describing the field stabilization as the reason the dog had survived transport, and a piece of paper with Maya Callahan's name on it that felt like something that needed to be treated seriously. He found out what had happened to her by the following morning. The military community in Petawawa was not large, and it was not quiet, and the story moved through it quickly, picking up momentum the way injustice always does when it happens to someone who didn't deserve it. Reyes told his CO. His CO, a major named Gilles Fontaine, was the kind of officer who believed in direct action over bureaucratic complaint, and he had a particular view of debts that needed to be repaid. He also had a phone. By Thursday morning, Fontaine had made contact with the base legal office, the Canadian Forces Provost Corps, and a colonel at National Defense Headquarters who had once served in the same unit as the Hawthorn General Chief of Medicine and held a grudge that Fontaine was perfectly willing to activate. He also made a call that he described as a courtesy notification to a joint task force team that was temporarily stationed at CFB Trenton, 60 kilometers from Hawthorn. He did not specify what he was notifying them of. He didn't need to. Maya was at home on Friday morning when her phone rang. It was Carla from the Nurses Association. "I need you to be at the hospital at 2 o'clock, Carla said. "Pruitt has been asked to attend a meeting with the Chief of Medicine, Hospital Legal, and HR. You're going to be there too. What happened?" Maya asked. The hospital received a formal complaint from the Canadian Armed Forces on Wednesday, specifically from the commanding officer of the unit Bravo belongs to, and countersigned by someone from NDHQ whose name apparently made the legal team sit up very straight. There was a controlled satisfaction in Carla's voice. They've also been contacted by the Ontario College of Nurses because a complaint was filed, not against you, against the hospital, for creating a policy environment that would result in a nursing professional being terminated for rendering emergency aid. Maya sat down. "That's not all," Carla said. "Okay, do you want to know what else?" "Yes," Maya said. "I really do." She arrived at Hawthorn General at 5 minutes to 2, which was not her nature. She was usually early, but she had spent 20 minutes in the parking lot, making sure she was completely calm before she went inside. She was wearing real clothes instead of scrubs for the first time in as long as she could remember, and the strangeness of that, walking through the doors of her hospital in a coat and boots, felt like a particular kind of loss. The lobby was quiet, then it wasn't. She heard them before she saw them. The specific quality of booted footsteps that moved with a coordinated intention that you didn't hear in civilian spaces. She turned toward the entrance, and there were 6 of them coming through the main doors, Joint Task Force 2 operators in service dress, not tactical gear, because they were not here for tactical reasons. They were here for a different kind of statement. Corporal Reyes was with them. He was in his dress uniform, which meant he had been planning this, which meant someone had let him know. And at the front of the group was Major Gilles Fontaine, who had the build of someone who had never once let an injustice stand without doing something about it, and who walked through the lobby of Hawthorn General like he had walked through much more difficult places, which he had. Maya stood completely still. Fontaine saw her. He changed direction. He stopped in front of her, and he did the thing that military officers of his rank rarely do without deliberate intention. He looked at her directly and said, plainly, "Master Corporal Bravo is alive because of what you did. The Canadian Armed Forces is aware of what happened to you as a result. We are here to make sure the appropriate people understand what they've done." Maya thought about all the things she could say. She said, "How is he?" Fontaine's expression shifted in a way that was hard to name. "He's going to be fine. He'll be back on duty in 8 weeks. Maya nodded once, the way you nod at things that are both relief and grief at the same time, because she had been carrying Bravo's outcome in the back of her mind since Tuesday, and now she could set it down. "Thank you for telling me," she said. "Thank you," Fontaine said, "for what you did." The meeting in the conference room on the 3rd floor lasted 2 hours and 20 minutes. Maya, was not in the room for most of it. She sat in the waiting area outside with Carla and with Reyes, who had been excused from the meeting and who spent most of those 2 hours telling her about Bravo. His training history, the specific way he signaled when he was on a scent versus when he was just doing the motion of searching, the fact that he had a habit of stealing socks and would chew on exactly one before losing interest. The sock would always be left in the same place. Outside Reyes's door, slightly damp, clearly felt very good to chew. "He's left 9 socks outside my door in 4 years," Reyes said. "That's extremely specific information," Maya said. "I've kept all of them." Maya looked at him. He was 26 years old and had been deployed twice and had driven through a red light and 2 stop signs to get his dog to an emergency entrance in time, and he had kept every single damp sock, and she thought he was one of the better human beings she had encountered. "Tell me more about him," she said. So he did. At 4:47 in the afternoon, the door to the conference room opened. Diane Pruett did not look at Maya when she came out. The hospital's chief of medicine, Dr. Robert Sandhu, was the one who crossed the waiting area and crouched down slightly to be at eye level with Maya, who was sitting, and said, "We would like you to come back." Maya looked at him for a long moment. "I'd like to understand what happened. Diane Pruitt's decision has been reversed. She acted outside her authority and without legal consultation. You will be fully reinstated with back pay from the date of your suspension, and there will be a formal review of emergency protocols, including for situations involving service animals." Sandhu had the kind of face that was built for apologizing in a way that meant it. "I'm sorry this happened to you. Is Pruett still head of nursing administration?" A pause. "That is under review." Maya nodded slowly. "I want it on record," she said, "that I would do it again. Same situation, same morning, same dog. I would do exactly the same thing." "I know," Sandhu said. "That's the other reason we need you back." She started again on the following Monday. She came in early, which was her habit, and changed into scrubs in the locker room and clipped her badge back onto her chest and walked out into the emergency department that she had worked in for 6 years. The department that had in its way been hers. She knew where the good pens were kept and which of the overhead lights buzzed when it was going to rain and which patients needed an extra blanket, whether they asked for one or not. Dennis, the security guard, who had walked her out and hadn't been able to look at her, was at the front desk. He saw her coming and he looked directly at her and he said, "Welcome back, Maya," in the voice of someone apologizing for something he couldn't have prevented and trying to do it in 3 words. "Thanks, Dennis," she said. "Good to be back." She meant it. She walked into the morning. 3 weeks later, a package arrived at the nursing station addressed to Maya Callahan, RN, with a CFB Petawawa return address. Inside was a photograph, Bravo in a CGS rehabilitation pen, standing on all 4 legs, wearing his tactical vest, looking at the camera with the absolute confidence of an animal that knew his own value, and a note in Reyes's precise handwriting. "He remembered your voice when I played the recording of the call. His ears went up like he was listening for you. I thought you should know that. CPL, Reyes and MCPL." Bravo Maya stood at the nursing station and looked at the photograph for a long time. Then she pinned it to the board behind her workstation, next to the shift schedule and the pharmacy extension list and the note about the broken IV pump on Bay 7, where she would see it every single day she came to work, where anyone who walked past would see it too. Bravo looked out of that photograph with his ears pricked and his vest buckled and his whole body oriented forward, ready, the way he had been trained, the way he had always been, and the story of what it had cost him and what it had cost Maya Callahan and what it had ultimately meant was there in that image without needing to be explained. Some things don't need explanation. They just need someone who won't walk away.